the first place that we want to start, Katie, is what is the purpose of this psychological evaluation that many insurance companies want you to go through before you're approved?
I think it's twofold. So the first is to appease the insurance companies, which, I mean, we care, but really I find the next part much more interesting. So the first part is to make sure there's no major contraindications to having surgery. Surgery is not just operating on one part of your body, right? We know, as you all know too well, there is a strong component that can affect your emotional well-being. And if you are already not doing well, or you have a high risk of, certain things, or you are a substance user and you're struggling, it's not the right time. And so sometimes we'll implement a treatment plan in order to get you to where you need to be so that you can have the surgery. We try never to say no. We try to just say not right now. And what do we need to do to get you there? So there are lots of different things that would put a pause on the surgery. But for the most part, when people are engaged in the conversation and they're like, I see your point, I'm happy to do that, I'm happy to engage in any form of treatment that we're suggesting, we can get them to surgery. It's really about the willingness to engage in the treatment plan that we know helps them post-surgically. That is the biggest key for us.
I was going to say the two things that absolutely stand out to me is that you said surgery, not yet, not surgery, never, right? Now is not the right time. And then you're also entering into kind of this treatment partnership with somebody who very much wants to move forward with the surgery. But I think everybody wants to go through it and move through the post-op journey as best they can. So you're really setting them up for success by you, the patient, being honest about what you're really going through in the moment.